speaker for this month, Melinda Boss. Melinda is founder and chief investigator of the LACTA research group at the University of Western Australia. So she's joining us on a Saturday, which I really appreciate. Her practice-based research is focused on the support of effective lactation via translation of research practice. Melinda is also a registered pharmacist, and she received Western Australia's Pharmacist of the Year award in 2019 for her work on early nutrition. Research publications include 2 internationally recognized websites that assist in the support of consistent, effective lactation care, LactaPedia and LactaMap, which I think we'll be hearing about today. LactaPedia is a glossary of lactation terms that provides descriptive standards for scientific studies, policy, and medical care. And LactaMap is an online lactation care support system for doctors and other health professionals. Melinda also is passionate about the need for lactation education, and the objective framework is to describe normal lactation function developed during the creation of LactaMap has provided the foundation for an online postgraduate course that is being attended by clinicians from a range of health disciplines residing across Australia. So it's a great pleasure to welcome Melinda. As I mentioned at the top of the call, I had a chance to meet her in person on my last big trip before the pandemic. I was fortunate to be invited to Australia to give a few talks. And I actually said to the organizer of this talk, I said, I will only come if you do a talk in Perth, because I want to visit Melinda Boss and Donna Geddes and the rock star lactation scientists in Western Australia. And so she accommodated that request, and I got to speak in Melbourne and in Perth. So it's wonderful to have you here at MILC Club, Melinda, and I will turn it over to you.
You're very kind. Thanks, Megan. So yeah, thank you so much for having me. In order to talk to you today about why consistency in lactation language is so important, I'm going to introduce you to the background work that we did that led to the creation of LactaPedia, which is our lactation glossary for science and medicine. So as Megan said, our work aims to support consistent, effective lactation care by decreasing the time it takes for new scientific knowledge to reach patient care. So I'm going to talk to you a little bit about 2 of my research publications, which are the websites LactaMap and LactaPedia. So to set the stage, over the last 150 years, there have been significant advances in reproductive technology. Reproductive physiology, and these have resulted in really a spectacular decrease in both maternal and infant mortalities. These include things like assisted reproductive technologies to facilitate conception, pregnancy assessment using ultrasound, measurement of reproductive hormones in blood, and the introduction of neonatal intensive care units. But unlike the other phases of the reproductive cycle, over this time, lactations declined in both initiation and duration rates. This graph shows breastfeeding rates around the world, and you can see in developed countries, breastfeeding hit a low around the world in about 1972. Now, since then, interventions like the replacement of chloroform with epidural anaesthetics, as well as education from advocacy and peer support groups, have been quite instrumental in turning around the poor lactation or breastfeeding initiation rates. But the struggle to sustain lactation continues. These statistics are from Australia, but they're roughly reflected around the world in high-income countries, in that we have pretty good breastfeeding initiation rates, but most women are unable to sustain lactation for minimum recommended durations. And this is really quite a problem because many of the important health outcomes that lactation confers on both women and their infants are dose-related and extend across the lifespan. So why is this so? There's many reasons, and the particular area that we're interested in is the prevention of conflicting advice and bridging the evidence to practice gap. We know that mothers are reporting varied, inconsistent and incorrect advice provided by health professionals as a common reason for early weaning. We also know that if we integrate evidence-based knowledge from scientific research into clinical practice, that this is proven to be an effective strategy for standardising clinical care and optimising outcomes. Unfortunately, if we compare lactation and the lactating breast with other major organs like the heart, lungs, liver, brain and kidneys, although this is improving, basic research into lactation function is relatively limited, and much of the knowledge that we do have is not making it to patient care. And in fact, it's often quoted that it takes around 17 years for just 14% of original research to be applied to patient care. So how can we close this gap? One of the ways that we've developed to do this is a website called LactaMap. It's a free online lactation care support system. While I'm talking, you'll see a recording of a clinician who was given a case study and is using that to guide their journey through LactaMap as they find the information they need to come to a clinical decision. So LactaMap was developed by a multidisciplinary group at the University of Western Australia to support doctors and other health professionals caring for term breastfeeding women and infants. It's intended to be used during a medical consult, and the information in it is easily accessed without any prior training. Content is comprehensive. It took us more than 10 years to put all of the content together. LactaMap contains 113 clinical practice guidelines, as well as supporting information documents, patient information documents, and normal function articles. And these are all supported by more than 1,000 references. If you were really observant, you might have noticed that within LactaMap, we also have LactaPedia, which is a glossary of terms. So a significant problem that we encountered when we were collating all the information we needed for LactaMap was that there were no standards for definitions around lactation, including normal lactation function. It's very difficult to diagnose dysfunction if you're not really clear about what constitutes normal biologic lactation function. So during the reviews of the evidence that was required to create LactaMap, it was clear that many of the lactation terms and definitions were not consistent in the scientific literature. And of course, a consistent language is the most fundamental starting point that's required for consistent and effective care. Collation of such a large amount of lactation information for LactaMap provided us with a great opportunity to develop a comprehensive lactation glossary. So here's an example of the sort of problems that we encountered and how it can impact on both the interpretation of scientific studies and also on medical care. This systematic review of observational studies was found when we were looking at the evidence around the impact of breast reduction surgery on breastfeeding. This review concluded that breastfeeding was successful in 100% of women where I can't read some of the writing here, where preservation of the column of the parenchyma from the areolar complex to chest wall was retained. But it mentioned or specified that most studies used as the definition of breastfeeding success of less than a month. So this definition of breastfeeding success, which I use in inverted commas, is confusing. It's not what you consider to be normal lactation function, and it's not a reasonable physiologic measure of success. So in fact, if you use such a concept of successful breastfeeding as a health professional, as advice for women who wish to breastfeed after breast reduction surgery, it's likely to encourage surgery prior to the completion of childbearing because it suggests that surgery has no impact on breastfeeding. In fact, for women to make informed decisions about breast reduction surgery, they need to know that it may impact on their lactation and that they may want to consider deferring breast reduction plans until after breastfeeding is complete. So we published our glossary as LactaPedia, and this is also a freely available website. LactaPedia contains more than 560 terms, and they've been reviewed by 5 international experts in the field. These included Professor Rafael Perez Escamilla, Professor Peggy Neville, Professor Valerie Verhasselt, Professor Bo Lonadell, and Professor Donna Geddes. Now, I won't bore you with the details, but we did create a rigorous scientific procedure for inclusion of terms and definitions in LactaPedia, and we published that methodology. We combined multiple methodological frameworks to meet the needs of consistent healthcare and decision support, as well as the research requirements to facilitate generalisation of findings and comparison of data. And we were quite pleased to find that this methodology has also now been applied to the development of a glossary for another health discipline. Now, while we think we made a really good start with LactaPedia, we also invite anyone to provide suggestions, comment or critique via our discussion forums. Version control is a really important functional characteristic of glossaries, and it's important for retaining their usability over time. And the online format of LactaPedia allows us to vet and extend the glossary based on broader public feedback. So for example, here's a lactation consultant from Ireland, and she contacted us and she had a really good point. She had concerns regarding the term primary lactation failure. Now, we'd already flagged this term for update as the LactaPedia working group because we were concerned that mothers might feel that use of the word failure was a value judgment and might imply that they'd failed to breastfeed. Kiva's concerns were that the term implied a total inability to breastfeed, when in fact many of the women that she was seeing in her practice retained a partial ability to do so. And if they were diagnosed with primary lactation failure, it implied that they were completely unable to breastfeed. So we invited Kiva to participate in our editorial review process for update of this term, and it proceeded through our 7-step process for update and review, and it actually resulted in 4 new terms with definitions and 1 new definition for the term delayed secretory activation. So a small change actually can have a large impact, and it's quite an involved process. Details of this process are recorded in our shared drive, and the new updates to these terms went live in March last year. And after I communicated with Kiva and obtained her written permission, I publicly acknowledged her contribution on the LactaPedia website, and that means that she can cite that in her master's research should she want to. So I've talked about a little bit about why standards for lactation terms can have an impact in science and how that can also impact on our medical care. Here's an example of how we use LactaPedia in national policy. And this was during the development of the Australian National Breastfeeding Strategy. So a national health policy needs to define and aim for goals that optimises the health of the population. And one of the aims of the Australian National Breastfeeding Strategy is to increase the rate of exclusive breastfeeding. But we had concerns about the working definition that they had for exclusive breastfeeding. So this definition was that exclusive breastfeeding means that the infant receives breast milk, including expressed breast milk and milk from a wet nurse. With that term, without specifying that the expressed breast milk was the mother's own, and also including milk from a wet nurse, that meant that the mothers were being precluded from the health outcomes associated with breastfeeding. And when you have something that you're aiming for at a population level, you need to be aiming for something that's optimising health of the breastfeeding dyad. It's not that expressed breast milk and milk from a wet nurse are not important interventions, but we need to be aiming for a standard where we're optimising health outcomes. So we were able to change that definition to exclusive breastfeeding, meaning that the infant receives breast milk that just includes the mother's own breast milk, a few other things, but nothing else. I'd also like here to acknowledge that in the context of this scientific group discussion, I've used sexed language to describe the lactation phase of the reproductive cycle and to ensure precision and avoid confusion. The challenge is that these terms have dual meaning, and they are also used to define gender and how you, so not just function, but also how you identify. So where I've used terms like mother or woman and women, these should be taken to include people who don't identify as women but have given birth and are lactating. For discussions in the individual clinical setting, of course, inclusive language must be considered, and this includes consideration of other variations of the family unit where appropriate. And we're working on including gender inclusive terms in LactaPedia, but it's extremely complex and it's taking us a while. So you have to be patient with us there. So it's one thing to develop an intervention, it's another thing for it to actually be used. We're pleased to say that LactaPedia has more than 12,000 users spread across the world, so it is being used. This heat map shows where our users are located. About 20% of our users are from the United States, 20% are from Australia. We've got 14% in Germany and the rest spread around the world. We've also been cited in a global protocol that was developed by an official World Health Organization working group, which actually stated that many of the definitions are adapted from those provided in LactaPedia, which is an excellent resource in this respect. We've also found, whoops, I've just gone too far, sorry about that. We've also found other tertiary institutions, including information about the importance of consistent breastfeeding definitions and talking about LactaPedia, such as this one from the University of Michigan. And we're pleased to see that some scientific publications are also starting to cite LactaPedia to define terms in their papers or publications. So hopefully now you've got an understanding of why we developed LactaPedia, how it works, and why standards for lactation language are so important for science, medicine, and policy. Thank you very much, and I invite questions.
Thanks, Melinda. Great to see